Hello, this is Jeff Caney again. This is an interesting case. This is a 44-year-old male who presents with severe restrictive lung disease. And on the PA radiograph, you'll notice the lungs look very normal. We don't see any pleural thickening. And what we see at the bones and the heart mediastinum look normal. Patient's larger than average, so the lung volumes are slightly reduced. On the lateral view, we see that there is a slight kyphosis of the spine. We see, again, normal-looking lung parenchyma, no pleural thickening. If we zoom in, we can see the ribs look normal. We see pretty good disc spaces, so nothing really to explain this restrictive lung disease. Now, I will note the patient does have a history of ankylosing spondylitis, which only came to light at a later point in time when we went back and looked at this again. Patient had a CT scan for this shortness of breath, and the only real interesting findings on this scan are at the spine. And so if we go down the spine, we will see that there's fusion of the rib articulations with the transverse processes as well as at the head of the ribs. And in particular, notice you can see at this level it's completely fused. And this continues down for quite a bit. So this is consistent with the ankylosing spondylitis. If we look at the lung parenchyma, there's really nothing to explain the abnormality. We'll do a sagittal reformat, and we can see there is those syndesmophytes. They're not very well formed, but we can see that fusion along the facet joint articulations and then further out into the ribs. So my hypothesis is that because of the fusion of the ribs at the spine, when the patient takes in a big breath and the anterior ribs try to expand, there's often a little bit of rotation and they are unable to rotate. So this patient is unable to fully expand his chest because of the ankylosis, not because of any issues with the lungs themselves. So ankylosing spondylitis can cause restrictive lung disease. In many of the textbooks and some of the older literature, there's descriptions of biapical fibrosis. And as I pointed out, this patient does not have that. And honestly, I think that's an extremely rare manifestation. I've only seen one example shown to me on a really old case that was on a hard copy film. So from I believe the 1980s or 1990s. And talking to my colleagues, it's again something we don't see very often. So restrictive lung disease, you think of things like fibrosis, pleural thickening, other pleural abnormalities. You can have muscular weakness, diaphragmatic weakness, diaphragmatic paralysis, but don't forget the chest wall.